Hello, Assalamualaikum. Am I talking to Dr. Khairul Chang?
Waalaikumsalam. Yes, who am I talking to?
I am Hashima, the pharmacist from the outpatient pharmacy department. So I'm calling you to clarify a few things regarding the prescription you have issued to the patient named KJL who was diagnosed with post-operative neuropathic pain and musculoskeletal pain.
Okay, you may proceed.
So you have prescribed the patient with lidocaine patch. May I know for how long the patient should be on the patch?
Oh, the patient should apply one patch per day, and each patch must be worn for 12 hours.
Okay. And then you have also prescribed the patient with tramadol 50 mg twice daily. However, according to MIMS, which I have referred to, the patient shall take it every 4 to 6 hours.
I see. So, what is your recommendation?
I recommend to change the frequency from twice daily to 4 times a day.
Okay, I agree with that.
Okay, thank you, doctor. So last question from me. For how many days should I supply these medications to the patient?
Our medication should be supplied for 1 week.
Alright. I think that's all I need to know. Thank you, doctor, for your time and cooperation.
Yeah, you're welcome.
Assalamualaikum. I'm here to take my prescription.
Waalaikumsalam, sure. Please have a seat. My name is Hashima, the pharmacist today. So just to make sure I'm looking at the right prescription, may I know your full name?
My name is KJL.
Okay, Mr. KJL. Now I notice this is a new prescription for you. Do you mind spending just a few minutes of your time for me to tell you regarding some important information about your new medications?
Not at all. Please do.
Great, but before that, I would like to know, do you have any known drug allergy?
No.
Do you have any other medications that you are currently taking?
No.
What about any over-the-counter or herbal medications?
Nothing right now.
Okay, good to know. So your doctor have prescribed you with 5 medications. This is your first medication. It is called lidocaine patch 5%. This medication is applied on the skin to ease pain. There are a few things that you must keep in mind when applying this medication. First of all, make sure your skin is dry and clean before you apply this medication. Second one, you have to avoid to apply this medication on the mucous membrane and please avoid contact with the eyes. The third one, you have to wash your hands before and after use. The fourth one is you have to remove the adhesive layer and apply it on the most painful parts of the skin. The fifth one is you have to leave it on for 12 hours. Okay, the last one, after you take off the patch, do not put another one on that area of the skin for the next 12 hours. Okay. So, what did your doctor tell you to expect from this medication?
Doctor said it is effectively relieve my pain, but it is also common to have reactions where lidocaine patch is put during or after the treatment.
Exactly. There are some side effects that you could expect from this medication. You might get a little burning, swelling, redness, pain, itching or flaking. Most of the time, these skin reactions will go away after a few days. However, if any of these effects are very bad, bother you or do not go away, please do not hesitate to consult your doctor immediately. And if you miss a dose, remember to apply it as soon as you remember. And then if it is close to the time for your next dose, just skip the missed dose and apply the next dose on the scheduled time. And please do not put 2 patches at the same time. The second medication is called tramadol, 50 milligram tablet. It is for pain relief, and you have to take 1 tablet by mouth 4 times a day for 1 week. Okay. some side effects that you may expect from this medication include unusual sweating, vomiting, dry mouth, and abdominal pain. Okay, and it may also make your heart beating faster, cause dizziness or headache that may impair your ability to drive or operate machinery. Okay, but don't worry, they are rare, and hopefully you won't experience any of this. Okay, but if you do, please see your doctor immediately. Your third medication is called gabapentin 300 mg tablet. It is also for pain relief. Take one tablet by mouth 3 times a day for 1 week. This medication may cause dizziness or drowsiness, so if you are affected, please do not drive or operate machinery. There are more rare side effects such as weight gain, fatigue, loss of bodily movement, and shaking. Okay, and then your fourth medication is called pregabalin 75 mg tablet. So it is also for pain relief. You have to take one tablet by mouth 2 times a day for 1 week. This medication may also cause dizziness and drowsiness. So if you're affected, please do not operate or drive machinery. There are more side effects such as blurred vision, weight gain, irritability, loss control of bodily movement, and shaking. And then your last medication is called duloxetine 60 mg tablet. It is for pain relief. You have to take one tablet once daily by mouth for 1 week. Okay. Again, this medication may also cause dizziness and drowsiness. So if you're affected, do not drive or operate machinery. And there are more side effects such as unusual sweating, blurred vision, fatigue, difficulty to fall asleep, and shaking. Okay. And then if you missed a dose of any of these medications, it's okay. Just take the next dose as scheduled, but please do not double the dose. And then for all of these medications, you have to store at room temperature in dry place, away from sunlight and moisture. Also, please keep out of reach of children. Now, I have covered a lot of information. Just to make sure I have been clear, would you mind to repeat the basics of how to use the medications?
Sure. For the patch, I need to apply one patch daily for 12 hours and wait for another 12 hours for the next patch. For tramadol, I need to take one tablet 4 times daily, and then for gabapentin, take one tablet 3 times daily, and for pregabalin, I need to take one tablet 2 times daily, and the last one is duloxetine. I need to take one tablet and once daily.
Yes, excellent. So do you have any questions to ask me?
I don't think I have any.
Okay, as you may have noticed, your medications are supplied for 1 week. Therefore, after 1 week, we would like you to come again for checkup so that your doctor will check on how well you are doing with your medications. Okay. However, if you have any problems or side effects you are worrying about, or any inquiries regarding your medications at any time before your appointment, please do not hesitate to contact me or your doctor.
Alright,
I appreciate your time. Thank you very much.
welcome.